This is Stories from the States. I'm Chris Fitzsimon. There's a lot going on around the country every week in every state, and we're glad you're here with us to talk about what's affecting people in our communities. And thanks for joining this first episode of Stories from the States from States Newsroom. This week we're talking about Medicaid. New Medicaid requirements are on the way because of the Trump administration's so-called One Big Beautiful Bill that was passed back in July. That legislation will slash nearly $1 trillion in Medicaid spending over the next 10 years. Many stakeholders are now reacting to all these cuts.
Well, very surprising to me, the rural hospital systems are not bucking them at all.
The boxes that you need to check don't really go into detail about what a person's life truly is like and what their story is.
Today, we're heading over to the Midwest, to Ohio and Wisconsin. In Ohio, the Republican governor wants a work requirement for Medicaid beneficiaries, while one woman in Wisconsin is struggling to imagine what her future will be like under these changes. We'll hear from her in just a moment. In Wisconsin, over 1.2 million people are enrolled in Medicaid. One of the enrollees says the program is an actual lifeline for her. The 26-year-old has been chronically ill for half her life, and with the impending cuts to Medicaid along with other programs, she's not sure how her life might change. Joining me now is Emma Widmar from Wisconsin. Emma, thanks for being here.
Thank you for having me and letting me share my story with you.
Well, let's just jump in. Tell us about you. What brings you to want to talk about this? What's your experience with Medicaid and your situation?
Yeah, so I am a 26-year-old woman who is on Medicaid, but also Medicare. I was a typical child, so to say, for the most part. But when I was 12 years old, I started having a range of unexplained symptoms, going from anything from anaphylaxis to passing out, and nobody could figure out kind of what was going on with me. I was, at the time, an elite volleyball player, a straight A student, and my world changed overnight.
Well, that must have been jarring.
Yeah, it was a lot, for a 12-year-old. From the time I was 12 until 18, I was under my parents' insurance. But because my symptoms are unpredictable and ever changing, my mom, who worked as a school to work coordinator for people with disabilities, knew that I needed to be protected as an adult since I would not be able to have a job like a traditional 20-something-year-old. Therefore, we applied for SSI. That was when I was 18 years old. Most kids when they're 18, they might buy a scratch off. I was applying for Social Security, and that really provided me some support. The Medicaid and opened up a book of, resources that I didn't have prior being on a private insurance. Every day is a different day, but thanks to Medicaid, I know that no matter what my body's going through, I am protected and I'm going to get the care that I need.
Yeah, if you don't mind, I know it might be difficult to talk about. What sort of days do you have, or what are your struggles during the day?
Everything looks different as far as symptoms. Sometimes I'm experiencing low blood pressure, so I have fainting spells. Other times I have anaphylaxis, which is a life-threatening allergic reaction without explanation. It's idiopathic. Other times I'm having severe bouts of vomiting. So I have these physical symptoms. Along with that, I've developed, medical PTSD due to near-death experiences. But in my day-to-day life, the most challenging thing on top of trying to manage my symptoms is the fact that I live in a system where I'm relying on healthcare. Um, I'm relying on the government, and I have to navigate these programs while not feeling well.
And they're complicated. Tell us about how that is. How does that work?
So that's the most difficult thing that I have to go through is say that it's reapplying for food stamps each year. They go through several questions of, what your life looks like, but it doesn't account for things such as, my service dog and how that is a medical expense. So there's different ins and outs that not only do I not know, but sometimes the workers don't know. So you're sitting on the phone making phone calls to people who might not have the answer for you. Not only that, you're waiting. There's hundreds of other people who need attention as well, and our systems are so in dire need of employees who know the ins and outs. It's a difficult job that they have as well. So, you're dealing with the people who are in control of food stamps. You're dealing with people who are in charge of long-term care. That's something that I have. I have two caretakers that's funded by a Medicaid. It's a Medicaid program. So if there's any issues in relation to that, I have to connect with the financial institution that pays my caretakers. I'm dealing with my case worker consultant. I'm dealing with multiple agencies. Even though they're together, they're separate.
And then what is it like navigating that world and then hearing a public debate about massive cuts in Medicaid, or in some cases, sadly, blaming people who are on Medicaid or saying they don't want to work? Or what's it like listening to that sort of rhetoric and debate given your situation?
Yeah. If someone looked at me from the outside, I am an individual with an invisible disability at times, and then other times I'm using a wheelchair. You can see my service dog, it's very visible. And I am an educated woman. I have a college degree. And oftentimes we judge without really knowing the situation. And it's like that for a lot of individuals who need support services. The boxes that you need to check don't really go into detail about what a person's life truly is like and what their story is. And nobody's story really unfolds in a questionnaire. So there's a lot of people on these supports, but there's also a lot of people who are not getting what they need as well. When I hear people who, claim to be pro-life or might say that they're a religious person, and then I hear them talk, negatively about these support services, it takes a personal hit to me because I know that I have the best setup, the best support, the best village surrounding me that makes sure when I'm falling through the cracks that I have a safety net and I don't fall. But it's not like that for everyone. I know that a common thing is that there's so much fraud, that there's so much misuse, that, people are being granted these services when they don't really need them. And I know that I fully need them. And I struggle. I have my parents who are both college educated as well. We're white. We do not look like the bias that people have when it comes to Medicaid or social services. And we struggle to figure out these programs.
What's at stake for you? What would happen if there were cuts to your Medicaid services, or if they made it more difficult even to receive them?
It could send me into a panic attack thinking about that, to be honest. And it is a discussion that I've had to have with my loved ones, with people around me. I simply would not be able to have a quality of life. I would potentially, I could die. And I think people think that I'm being dramatic when I say that, but it's true. In 2020, I connected with the Aging Disability Resource Center out of Racine County, and I was looking at the different plans of like what would work best for me and my medications and where they're covered and so forth. And they estimated in 2020 that the meds that I'm on, not counting hospital visits, doctor visits, additional needs, they estimated that my medications were worth $2 million. And I don't know about you, but I don't have that kind of money laying around. Social Security, unfortunately, does not pay out that much each month. And I know that it just would be an undertaking that it would be so overwhelming to get the medications that I need, to get the infusions that I need, to get the caregiving that I need. I just simply wouldn't be able to function. And we're already struggling with what we do have. This is a bone that we get. There's so much more that we need. So it's just terrifying to think about. And, some people say, oh, it won't happen. They could never do that. But I think that this government and this administration has shown us that anything truly is possible. Like, there is no limits to what they are willing to go through. And I'm the person that they don't care about. I'm the story that they don't know, and they're fine with letting me slip through.
And finally, before we let you go, given that you are part of community, that you've talked to other folks, and given your personal circumstances, if you could get one point across to policymakers or people who are they've already passed this bill, but some of the most restrictive provisions don't go into effect. There's always time, I think, for things to change. What would you want policymakers, especially in Washington, to know?
I just want people to understand that it can happen to you. It it will happen to you. You're going to age. So say that you don't, get affected by long COVID, or you don't develop cancer. You are going to age. And as you age, you are going to have ailments. You are going to become disabled. Those with disabilities are a part of the largest minority because it is a minority that anyone can enter at any point in your life. And when lawmakers are discussing policy, I wish they would keep that in mind, that it can become them, it can become their grandchild. And I am somebody's daughter, I'm somebody's aunt, I'm somebody's partner, and you are too. So when you're thinking about these policies, think about it for yourself, because you could become reliant on it, and life could happen. You could have a car accident. Anything's really possible, and we need to keep that in mind, that we need to take care of our people because they're who takes care of us. So I think that's the biggest thing that I wish people understood.
Well, thank you very much for sharing your story. Really appreciate it. Thank you, Emma.
Thank you so much, Chris.
In a moment, we'll head to Ohio. U.S. senators there have been celebrating the cuts, but according to a reporter from the Ohio Capitol Journal, not many others are joining them. Then we'll chat with Evening Rep newsletter writer Danielle Gaines on the top stories to look out for. One of the biggest changes is the federal government implementing work requirements for those receiving Medicaid benefits. According to reporting from KFF Health News, there are estimates that most of the Medicaid savings will actually come from attrition caused by work requirements. The Republican governor of Ohio also had requested state work requirements for those getting Medicaid benefits. That happened before passage of Trump's big, beautiful bill. Ohio will see a $33 billion cut in Medicaid when that legislation goes fully into effect. Many lawmakers have celebrated the Medicaid cuts. To explain more about what's happening there in Ohio is Marty Schladen, a reporter at the Ohio Capitol Journal. Marty, thanks for joining us today.
Well, I'm happy to be here.
I think most folks have heard the news about what was in the so-called big, beautiful bill, I guess, that the president was trumpeting. And you live in a state with a Republican governor who has, in some folks' mind, not quite been fully in with the president. Other times he has. How is Governor Mike DeWine handling all this?
Well, he's always prided himself on being a pro-child, pro-family governor, and sincerely so. But as you alluded, he's had kind of a fraught relationship with President Trump, especially during the pandemic, because DeWine was trying to take everything the health people were saying very seriously. But now that we're looking at these, big cuts to the social safety net, the governor's actions, I would say, are maybe not all over the place, but a little bit scattered. For example, he's requested to do work requirements here in Ohio, even though there's no evidence that it moves the needle in terms of employment at all. But at the same time, I know he's concerned about, especially programs for children.
What's the concern? What do you think the biggest impact of this bill on Ohioans who either receive Medicaid or other Ohioans who just are in the healthcare system? What's going to happen, do you think?
Well, there's a few different levels to this. First of all, I think in Ohio and a lot of other states, there are really just a lot more poor people than those of us who are relatively comfortable want to think. Well over 25% of Ohioans are poor enough to qualify for Medicaid. Almost half of all childbirths are covered by Medicaid. But those aren't the only populations who are going to be affected when $1 trillion is ripped out of this system. A few months ago, I spoke to the head of the chapter, the Ohio chapter of the College of Emergency Physicians, and her whole point was emergency rooms still have to care for people regardless of whether they can pay or not. And they're going to start getting hit with a lot more uninsured people. And the hospitals are going to have to figure out how to deal with that. And her prediction was when you go to the hospital, you're going to wait a lot longer for somebody to see you. And then there's this phenomenon of patient boarding that I just learned of, which is where you wait in the emergency room when they want to admit you until an appropriate bed opens up. And, horrifyingly, that's already happening in some instances where people have to wait 24 hours. And she said that's going to go up. Hospitals are going to have to, cut in other places. So that's the way that these big Medicaid cuts are going to affect people who aren't on Medicaid, according to her.
And what about just hospitals in general? I mean, are there rural hospitals in Ohio who rely on Medicaid funding to stay afloat?
Oh, definitely. And they're struggling. They're just keeping their heads above water now. And the fear is, this is going to be the straw that breaks the camel's back.
Well, let's talk 1 second about the work requirements in particular, because you do hear a lot of conflicting information about the rhetoric from the supporters of the bill is that we need to get able-bodied Americans to work and not rely on public assistance, and they can get a job and get health care, or they can get a job and continue to get Medicaid. Why would that be so hard? How do you explain that to people who just hear that and it might sound like something that makes sense?
Well, it misunderstands the reality as it is. I mean, just on all kinds of Medicaid, the majority of able-bodied working age adults who are on Medicaid have jobs now. In the Ohio's an expansion state. We've got 770,000 people in our expansion population. 92% of those are either working, going to school, have care responsibilities for parent or child that preclude them working, or they're sick.
Well, yeah, the senators from your state, Moreno and Husted, have said that these cuts somehow help average Ohioans. And I wondered, is that true? What's your reaction to that?
Well, so what they're hanging their hats on is late in the One Big Beautiful Bill Act, getting it over the finish line. There were some Republican senators who, I think Susan Collins of Maine being one, saying, I can't sign this. So particularly because of the effect it would have on rural hospitals. So they built back in $50 billion in subsidies to rural hospitals. And that's just a fraction of what they will lose overall, according to every analysis I've seen in Medicaid funding. But Houston and Marino are only focusing on that. And well, very surprising to me, the rural hospital systems are not bucking them at all. They're saying, thank you, thank you, thank you for this. We're going to be better off. But every other outside group I talk to, I look at, this is a net loss to those hospitals.
Do you have a sense of how folks in Ohio do they understand the things that we've been talking about? What do you think the feeling is in Ohio about this bill and how it affects them?
The bulk of the Medicaid cuts and the Medicaid work requirements do not take effect until after the midterms next year. So I think some of the effects are intentionally delayed here.
Well, I really appreciate you being with us, and we really appreciate your reporting there at the Capitol Journal. Thank you very much.
Thank you very much, Chris.
Coming up shortly, Evening Wrap newsletter writer Danielle Gaines will join us with the top stories she's looking out for, and with one last thing. One of the best things about doing this podcast is I get to spend a little time with Danielle Gaines. She's the author of the Evening Wrap newsletter for States Newsroom. If you haven't subscribed to Evening Wrap, you should. Danielle, how are you?
I'm great. How are you?
Good. You read so much news about what's happening across the country. Tell us something that you've noticed that was happening this week.
Sure. Well, I could not let election week pass without talking about election reactions across the country. So Tuesday was a big night for Democrats who, as the president put it, won the states that they were supposed to win. But they also won several that they weren't necessarily favored for. So in Virginia, Democrats saw a clean sweep of the top constitutional offices in the state. And they also saw a big advantage in the House of Delegates. The legislature there has had razor-thin margins for many of the last several years. In Georgia, 2 Democrats won statewide office as utility regulators. They are the first Democrats to win statewide in 19 years. So the party is very excited about building momentum there. In both states, the party attributed their success to affordability messaging and really talking about kind of financial issues, things that matter to households and household budgets. In New Jersey, the losing Republicans said that President Trump was at the center of their losses, which is kind of interesting.
That's unusual for them to say, but...
Yeah, going out on a limb there. And then, a lesser kind of race that people weren't paying as much attention to, but it was really fascinating, is in Pennsylvania, where Supreme Court judges won retention elections despite, a campaign by conservatives against them.
That was an interesting race in Pennsylvania. So what are you watching for this coming week?
Yeah, so a thing I'm watching this week is a Missouri ballot language fight, which there's always Missouri ballot language fights. And they're always kind of fighting in court about whether or not ballot initiatives are being written in a purposely deceptive way. So this particular fight is about the gerrymandered congressional district map that was just passed by Republicans. Republican Secretary of State Denny Hoskins wants to tell voters that the new lines, quote, better reflect statewide voting patterns. And that replaces a version that uses the word gerrymandered. And he also likes the phrasing, quote, protects incumbent politicians. So that'll be something interesting to see how that unfolds. He has been losing in court recently on these issues.
A lot of odd wordsmithing. Okay, and tell us, we're going to get used to you telling us one interesting thing every week, one last thing. What is one last thing this week?
I really love stories that get deep into the weeds on things that you've possibly never thought of. So I'm loving this story this week from Maryland about planting underwater grasses in the Chesapeake Bay. So restoring underwater grasses is part of a multi-state effort to restore the water quality in the Chesapeake Bay. And the underwater grasses do so many things. They provide critical shelter to lots of various species, including Maryland's famous blue crabs. And, they absorb nutrient pollution and prevent algae blooms. And Maryland Matters had a story where they just talked about how they go and plant these. And they basically chuck a bunch of seeds off of a boat mixed with sand so it falls to the bottom. But more interesting is how they harvest it. So in the summertime, a bunch of state employees and environmentalists put on waders and they take laundry baskets out into the water with them. And they just, clip off the top parts of plants and fill up 20 to 30 laundry baskets at a time. And then a turbulator separates the seeds and then they plant them as needed. It's just a very interesting thing that you might not have thought of.
I wonder where you buy a turbulator.
That I can't tell you.
Well, Danielle, thank you very much. We look forward to our continuing conversations. Thanks for all your help.
Of course. Thank you.
Thanks for listening to Stories from the States. I'm Chris Fitzsimon. Mallory Chang produced and edited this episode. David Singer produced our theme music. And a special thank you to Eric Gunn at the Wisconsin Examiner. If you liked what you've heard today, please subscribe to Stories from the States on Apple Podcasts, Spotify, or YouTube. We'll talk to you soon.